Hello, everyone. Welcome to my cancer epidemiology presentation for liver cancer. This is for EAB 755. This is part of my Master's of Public Health program, and everything that I'm presenting here today is retrieved from credible data sources, and they're not views of my own. So just a little quick overview of what I will be covering today. I will be discussing the introduction to liver cancer, different signs and symptoms presented with the diagnosis, how to diagnose liver cancers, risk factors that are associated with liver cancer, distribution across the United States regarding epidemiology and several statistics, and distribution also by race and ethnicity, preventative measures, and current treatment options. So just a little quick overview about the liver. The liver is a football-sized organ, and it's positioned in the upper right quadrant of the abdomen beneath the diaphragm and above the stomach. It is a type of cancer that begins in the cells of the liver, and those cells are known as hepatocytes. The liver has a lot of different functions, but some of the functions that it is well known for is filtering blood from several toxins, whether they be drugs or alcohol. They maintain healthy blood sugar levels. They regulate clotting factors in the body, and they also produce bile that helps digest fats and several other things in the large intestines. So there's four main different types of liver cancers that is currently known. The most common type is hepatocellular carcinoma, also abbreviated as HCC, and it accounts for approximately 75% of all cancers. So it develops in the hepatocytes, and it could spread to different. It could, detach and spread to different parts of the body, whether it be the pancreas, intestines, or stomach, even the bones, and leading to other different types of cancers. There's also cholangiocarcinoma. This is bile duct cancer, develops in the small tube-like bile ducts in the liver, and then the duct's function is to actually carry bile to the gallbladder to aid in the digestion. There's also liver angiosarcoma. This is a very rare form of liver cancer, but it initiates in the blood vessels of the liver. It can what's really bad about this type of cancer is that it progresses quickly and it tends to have a late diagnosis, which would impede treatment options. And there's also hepatoblastoma. This is very, very rare, occurs in children, usually less than 4 years of age, and it accounts for less than 1% of liver cancers. So there's different types of risk factors that lead to the development of liver cancer or hepatocellular carcinoma. But I'm just going to list a couple of them. So, chronic infection with HBV or HCV virus, hepatitis C or hepatitis B, increases your risk of liver cancer. So, that's why it's important to get vaccinated, and we'll discuss those a little bit more later on. Liver cirrhosis, this is scar tissue that forms due to liver damage, whether it be from alcohol or other substances that person abuses. There's also different inherited links of liver disease. These can increase these increase with the risk of liver cancer um, by having hemochromatosis and Wilson's disease. And there's also people are at higher risk as well if they have diabetes or they are obese. There's also non-alcoholic fatty liver disease, which is adipose tissue that develops around the liver, that could also lead to liver damage. And then there's exposure to aflatoxins. I thought this was kind of new to me. I did not know about this one, but it's very interesting that it can happen. So it's a type of fungus that can grow on crops such as peanuts, wheats, and soybeans, groundnuts, corn, and rice. And if it is stored in a moist and warm environment, those can actually grow. And when they're ingested, it could potentially lead to cancer in the river. Very rare, not very common in the United States, but it's mostly common to other regions of the world that tend to be underdeveloped. There's also excessive alcohol consumption. This probably is one of the main risk factors. So consuming more than a moderate alcohol daily over many years can lead to severe liver damage and increase your risk of liver cancer. So most people don't really have and symptoms of liver cancer in the primary stage, which makes it kind of hard to diagnose. But when they start to appear, they include losing weight without trying. I've seen some patients that have like they lose weight in several of their extremities, but their stomach tends to increase in size, so abdominal swelling. There's loss of appetite, upper abdominal pain, nausea and vomiting, white chalky stools, and one of the most common actually is jaundice, which is yellowing of the eyes and um, the skin due to buildup of bilirubin. And then there's also white chalky stools. So, in order to diagnose liver cancer, there's several things that have to be played during the clinical examination. They start with just a general clinical checkup of the eyes and the skin to feel for the liver if there's abnormal swelling, um, and then there's also blood tests. So certain enzymes can detect whether there's elevated liver enzymes could be an indication of liver damage and eventually liver cancer. There's also imaging tests. So the doctor may order MRIs, ultrasounds, and CT scans. And then there's also one of very most common to kind of make it concrete that there is a diagnosis of liver cancer is to conduct a biopsy, and this is usually done in clinic when the patient awake. They take a sample of the liver and test it for any cancer cells. So after somebody is diagnosed with liver cancer, there's kind of four different stages that they diagnose the patient with: stage 1 through 4. And the lower the number, the less the cancer has spread. The higher the number, the more the cancer has spread. The United States tends to use a TNM system developed by the American Joint Committee on Cancer, and it's based on three different key pieces of information. So one of them is the size of the tumor, how large the cancer has grown. Is there more than one tumor in the liver? Has the cancer reached nearby structures like the veins in the liver? Has the cancer spread to nearby lymph nodes? And has the cancer metastasized to distant sites such as the bones or the lungs or the pancreas and so forth? So after the diagnosis of what type of stage the patient is in, there's several treatment options currently. This is just some of them, some of the main ones that I came across in my research. So one of them is surgery to actually remove the tumor. This can be a partial or complete hepatectomy, if I said that right. So sometimes they remove partially the liver and surrounding healthy tissue just to make sure the cancer will not grow back again. And then sometimes if it's spread through across all the liver, they tend to do a complete they tend to do a complete liver transplant from a healthy donor. There's also localized treatments. I thought this was really interesting. I was reading that one of the treatment is to actually present alcohol through a needle injection towards that cancer tumor if there's only one or two that they could reach from the superficial layer of the liver. They actually inject alcohol um, to kill those cancer cells. There's also radiation therapy and chemotherapy that is tend to be present with other cancers as well. But usually treatment is very personalized from patient to patient, and it could be a combination of all of these. So let's get into the epidemiology, the data and statistics regarding liver cancer. So the rate of new cases of liver cancer is about 9 per 100,000 men and women per year, and the death rate is about 6.6 per 100,000 men or women per year. These are age adjusted from 2014 to 2018 cases and deaths, and they were retrieved from the NIH. So this is the most recent data I believe that's present, and the lifetime risk of developing cancer is approximately 1% of men and women will be diagnosed with liver cancer or intrahepatic bile duct cancer at some point in their lifetime, based on the 2016-28 data that was collected. And in 2018, there was an estimated 96,178 people living with liver cancer in the United States. It is the 13th most common type of cancer in the US, with a median age of 65 years old at the time of diagnosis. So it's not really um, super rare, like super prevalent, sorry, in the United States. There's about a 20.3% 5-year survival rate, which is a lot better than other cancers from what I've seen, like compared to leukemia and osteosarcoma. There's an estimated 42,230 cases in 2021 based on previous data. That's about 2.2% of all cancer cases. And there's about 30,230 people that will die from liver cancer in the United States, compared to which is about 5% of all cancers. It tends to be increasing. So what we've seen in the past couple of years, that liver cancer is increasing prevalence and death rates, which is a definite call to action that we must intervene now, before those numbers tend to get to a point where it's difficult to find preventative and treatment options. And all right, so just a little bit more information. So cancers tend to be most common in men than in women. This is probably due to several of the risk factors that I mentioned, such as drinking, maybe some occupational things, such as second smoke, close to smoking as well, which contributes, obesity, eating fast food, stuff like that. Um, it tends to be prevalent more in older populations. Like I said, 65 is the median age, but diagnosis tends to be between 54 and 85 years old for liver cancer. Oh, sorry. And this data is presented by the CDC, and it was based on June 2021 um, analysis, that data collected from 1999 through 2018. So with liver cancer, like I said, males tend to be more associated with liver cancer than females, and the distribution is uneven between amongst races. So Hispanic and Latinos actually have the highest rate of liver cancer. Asian Americans and Pacific Islanders as well follow that, and then followed by American Indians, African Americans, and whites. So whites tend to have the least amount of cancer um, morbidity versus Hispanic populations in the United States. This is based on the 2018 data as well from the CDC. Um, and so it's also important to realize that these distributions, we tend to see these across several other cancers or diseases in the United States. So there's several ways to prevent liver cancer. Basically, just with everything in life, like obesity and stuff, it's important to exercise, eat right, practice safe sex, get vaccinated. Avoid drinking over excessive amount of alcohol, avoid using illicit drugs and toxins that the liver must filter out. So utilizing these things can have long-term damage on the liver. Um, so just maintaining a healthy lifestyle, maintaining a proper diet, watching your weight, avoiding things that are associated with other diseases as well. It's the same principle with liver cancer. And these are my references. So thank you so much for allowing me to present. And yeah, thank you.